So today we are going to see a section of the circulatory system, that is the cardiac cycle. Okay, so let's check it out. That is, first we have to know that what this term systole and diastole mean. So systole means contraction and diastole means relaxation. Simple words: systole, contraction; diastole, relaxation. When there is ventricular systole, there is arterial diastole, and when there is ventricular diastole, there is arterial systole. And basically we consider, or whatever we talk about the cardiac cycle or the blood pressure, we mainly refer to the ventricular systole or the ventricular diastole. Okay, and the thing is that the thing which will happen to the ventricle will just be opposite to the arterial. Okay, means if it is relaxation for the ventricle, it will be contraction for arterial. If it is contraction for ventricle, it will be relaxation for the arterial. Okay, so ventricle is systole, arterial is diastole. Ventricular is diastole, arterial is systole. Now we will come to the ventricular systole or the arterial diastole. What happens in this stage? In this stage, the ventricular muscles contracts. Okay, the ventricular muscles contracts. The arterial muscles relaxes. The auricular muscles relaxes. The semilunar valves or the aortic semilunar valve and the pulmonary semilunar valve opens in this stage. Okay, means they are not closing, they remains open. Now where is the blood flow? Means from where does the blood flow to which part? So the first is from the right ventricle. The deoxygenated blood will flow to the pulmonary artery through the pulmonary semilunar valve. Okay, and from the left ventricle, where we will find the oxygenated blood, it will go to the aorta through the aortic semilunar valve. In this case, the tricuspid and the bicuspid valves closes with a jerk that produces the lub sound. The bicuspid and the tricuspid valves closes with a jerk, which will produce this lub sound. And cordia tendineae holds these bicuspid and tricuspid valves in position to prevent the upturning of the valves, so that they are not turned in the opposite manner, thus which would lead to the backflow of the blood. So it is the longest phase also. This ventricular systole or the arterial diastole is the longest phase in the cardiac cycle. Okay, so once more, the ventricular muscles contract, the auricular muscle relax, the semilunar valves opens, the blood flows from right ventricle to the pulmonary artery through the pulmonary semilunar valve, from the left ventricle to the aorta through the aortic semilunar valve, and the bicuspid and tricuspid valve remains closed, which produces the lub sound. Means when it closes, it produces the lub sound. And cordia tendineae, you may say they are the support for the bicuspid and tricuspid valves, so that they are not upturned. And it's also the longest phase. Now we'll come to ventricular diastole or the arterial systole. Ventricular diastole or arterial systole. In this case, the arterial muscle contracts. Okay, and the ventricular muscle relax. The tricuspid valve and the bicuspid valve remains open. Okay, the blood flow is from the right atrium, which is deoxygenated, to the right ventricle through the tricuspid valve, and from the left atrium, which is oxygenated blood, to the left ventricle through the bicuspid valve. And the semilunar valves, like the aortic semilunar valve and the pulmonary semilunar valve, closes with a jerk, which produce the dub sound, preventing the backflow of blood in the ventricles. So what have we seen? The main difference is that in the systole, in the ventricular systole, we have seen that the tricuspid or bicuspid valves closes with a jerk, producing lub sound, and in the ventricular diastole, we are seeing that the semilunar valves, like the aortic semilunar valve and the pulmonary semilunar valve, closes with a jerk, which is the dub sound. Okay. Now we'll come to the normal blood pressure. So ventricular systole equals means they are the same, atrial diastole, which is having the pressure of 120 mmHg, that is millimeter. Hg means mercury pressure. Okay, millimeter mercury pressure. And the ventricular diastole and the arterial diastole has the pressure of 80 millimeter barometric pressure. Okay, and it is written as 120 by 80. The normal is 120 by 80 mmHg. Okay, 120 by 80 mmHg. So this was a small video where I wanted to say you about the systole and the diastole, which is mostly been misconceived by many. So thank you and have a nice day. Bye.